So we are presenting on social workers and case managers. As you guys know, it's Rocco, Mitchell, Kevin, and Kieran. So before we get into our presentation, we're going to kind of talk to you guys about our clinical experience and kind of how we dealt with social workers and our background with them. So I was in the SNF setting, and honestly, before my clinical, I really didn't know like what social workers did. I worked in an outpatient clinic back home, and some of our PTs would talk. I knew they'd talk to case managers kind of about patient visits and trying to get more visits for their patients. But as far as social workers went, I had never really worked with one, and I had never really had the experience of being a patient to where they were working with me. So what my day entailed as far as the social workers went in the SNF, I probably talked to them, I'd say at least 2 or 3 times a week, if not every day. They kind of want to know what's going on with the patients as far as their mobility, and they're kind of more interested in like your discharge planning. So if we had a patient and they were going to be going home, the social worker would approach me and ask kind of what I was thinking, and she would kind of give me her input after that about what kind of places we could possibly send them to, because as we'll get into it, they're kind of responsible for kind of setting that patient up after the discharge with everything that they're going to need to be kind of independent.
So my setting was the acute care, and similar to the SNF, but so what happened was every day we would see a patient, and after that patient we would go talk to a social worker or case manager, tell them how the patient did, any updates, and if it was a new patient, just what we would recommend as far as discharge. Just like Kevin was saying, some of the options that we had were to go to the SNF, to go home with home health, or outpatient. And so we would tell the caseworker or social worker basically what we saw with the patient, how they were doing, what we recommended, and then there was also rounds every day at 10 o'clock that there would be the rehab team, case manager, social worker, surgery, trauma, like all these different fields would come in and talk about each patient. They go room by room and talk about each one and see like how they're doing, what their recommendations are. And basically it was a meeting for the social worker and case manager to understand kind of the whole picture of the patient for every patient, and depending on like what they feel and what all the recommended, like everyone's recommendations show, that's their next like plan of care, depending on if they would go to the SNF or go home. And so yeah, it was basically every patient we would have some kind of interaction with the social worker or case manager. So that was my background.
So for me, I was in outpatient clinic, and my experience was a lot different than theirs, obviously, but probably more so than most of you, because at my clinic we were also connected to a company called WorkPro, which was entirely like workers' comp. So they did a lot of like the drug screening for workers. They did a lot of the functional like assessments, like pre-screening for workers. And then anyone that got like injured on the job would go through WorkPro, and then they would typically get referred to the sports medicine doctor who was also in like the same building as me for like an X-ray. And if like nothing was like too serious, they would pretty much instantly be shipped over to therapy for like 8 to 12 visits. So I worked with the case manager a lot through WorkPro because I had a lot of workers' comp patients, and I had probably at least 5 or 6 patients for workers' comp a week, and I would meet with the case manager once or twice a week to basically just talk about how the patients were doing, if they were showing up to therapy sessions, if they were being compliant, and then just like really just talking to the case manager about how we could provide the best care for the patients.
And just like Mitch, I was also an outpatient, but mine was a lot different than that. I didn't really work with a whole lot of other professionals, especially non-social workers or even case managers, which, hindsight's 2020. I thought that was super weird now after going through all of this, because the clinic that I was in, we served a lot of patients that had low socioeconomic status, and also, we also got a lot of, I know pain management, we're going to learn about that later on in a few weeks, but I thought there was, after learning a lot of social work case manager, they're kind of like the guy or girl that brings everyone together, and working with other interdisciplinary teams, I thought I would see a little bit more of that. And since I had no idea about it, I thought it'd be pretty cool to learn about it.
So this is just kind of what we're going over. We're going to go into the background on like social workers and case managers. We're going to tell you about some of you're going to get a TED Talk from someone for a little bit. Their education, we have some interviews for y'all. A couple organizations, kind of like APTA is for us. Each social work and case managers have that. Some research that we found. We're going to explain the differences between the two. And then get into passport services, which we'll explain to y'all later, and some patient cases and a quiz. So, what is a social worker? This is about like as broad of a definition as we could find, because I mean, really, we're going to go into it, but there's so many different kinds of social workers, and they work in so many different settings. But they are mainly there to help individuals cope with problems and improve the person or patient's life. So they're going to teach skills and help develop mechanisms to better the patient's lives. And then this is kind of the one that I saw a lot, at least in the healthcare setting where I was, that they're going to kind of act as a liaison between institutions and other health professions to assist with patient wellness. Because you're going to have patients who are in the hospital and you're going to be sending them home, but they're going to need all these things to kind of help with their independence and to help them get better. And the average person, if you tell someone's family like this person needs to go live at a SNF, the average person may not be able to do all that research and find what SNF might be best for their loved one. So they can kind of help like do that research for you, give you pamphlets on all that. And then they also engage in addressing legal issues, research, and maintaining case history records. So the education for social workers, the minimum degree required to be a social worker is a bachelor's degree. So you could actually go to university, get your bachelor's in social work, and you could start right away working as a social worker. From kind of what I read on websites and everything though, these people are like, quote unquote, the low men on the totem pole, or women. They are obviously not going to get paid as much as the people who have more education, and they don't have as much freedom in their work of what they can and can't do with the patient. But you can go on to earn a master's of social work, and you don't have to have your BSW to earn your MSW. You can come in with, it made it seem like any kind of bachelor's work and earn your master's in social work. However, they did say if you have that bachelor's of social work, it might shave off even up to a year of schooling in your master's. So it might be better to start with that BSW. You have to have your master's in order to perform clinical social work, and I'm going to get into that here in a little bit. And then you don't have to have it to obtain a supervisor role, but you pretty much do from what I read. They pretty much said if you want to be a supervisor, you pretty much have to have the master's at this point. And then there's 4 levels of licensure. There's that bachelor's I talked about, the master's. The advanced generalists, they have to have their master's and then 2 years of it seemed like they made it seem like just 2 years of supervision in the field, like probably working under someone, but not necessarily at school. It can just be 2 years of working in the field, and then you can move up to an advanced generalist. To where to be a clinical supervisor, it almost sounds like they have to do what we do as far as clinicals, in the sense of you get your master's, but during your master's program, you're doing a clinical with another social worker for 2 years, like in that same field. And then this is just a TED Talk. She compares social workers to superheroes. If you hear her talk about that, we're going to start kind of in the middle of it.
Nice people with good hearts. Social workers are educated professionals who go through accredited university programs that are grounded in a rigorous research base. And what they learn there is part of what makes them a superhero. The two biggest things, they learn their mission and they learn how to make change happen. The mission of social work is to promote and support individual and community well-being and to fight social injustice. Social workers do that because we learn how to see and understand the invisible interconnections between people and their families and their neighborhood and their community and society and laws and policies. And we know that when those connections tangle or break at any of those levels, problems happen. So we learn evidence-based interventions that can help solve the problems around those tangles and breaks. And with that, we can make powerful change happen. Now, a second reason that I like to think of social workers as superheroes is because just like with a superhero, everyone is going to need a social worker at some point. Because everybody's going to face a big challenge in their life at some point. Maybe the challenge starts early and you're born prematurely. Well, who helps your new parents find a specialist or figure out how to pay those huge hospital bills or find a car seat for a teeny tiny baby? Hospital social workers. A little later on in life, you're in school and maybe you're being bullied or you're thinking about dropping out. Well, who designs and implements the anti-bullying and the dropout prevention programs in schools? School social workers. Later on, as you get older, maybe you face one of those grown-up problems, a divorce, or you lose your job, and you sink into a depression. Maybe you even start drinking too much. Well, who do you turn to for counseling and therapy? Licensed clinical social workers. Did you know that the majority of mental health services in this country are provided by social workers? It's nearly 70%. And then, for those really tough end-of-life issues, your 86-year-old dad has Parkinson's disease, but is insistent that he can live independently. Who helps you figure out if he really is safe? Or who helps you find in-home health? Or navigate those really difficult conversations about wills, and power of attorney, and DNR, geriatric social workers. Then there's the bigger picture. Who's running the nonprofit agency, who's organizing the community, who's fighting to make sure that the laws and the policies are just and fair. Those are social work managers, organizers, and advocates. So at some point, everybody's going to need a social worker.
Okay, so she kind of hit on some of these, but like she said, it's not just in hospitals that you're going to be seeing social workers. They can be in a lot of different environments. So we're going to go over some of the different ones. There's clinical social workers, child and family social workers, healthcare social workers, and then mental health and substance abuse social workers. So the licensed social worker is kind of that last part I talked to you about on the education. They need that 2 years of shadowing someone in this field. A lot of them do work with clients in the field of mental and emotional health. They can specialize in multiple areas, however, that include substance abuse, public health. They can be in the medical field of social work or marriage counseling, and then children and family therapy. So like we were saying, the most common path for the licensed clinical social worker is mental health counseling. And it's kind of like she said in that video that the social workers provide, I guess, as she said, 70% sometimes of the mental health counseling in our country. And they are allowed to have a direct role in the psychological interventions for patients.
So I'm going to talk to you about some of those specific types of social workers. The first one is child and family social workers, which is probably the more commonly heard of outside of the hospital. So what the child and family social worker, they're also known as social work, social services, or human services, which I mean everyone should or have previously heard of. Their primary focus is to provide social services to help people care for themselves, as well as provide basic needs for the children. Some of the issues that they deal with is substance abuse, mental health, anger management, domestic violence, poverty, unemployment or underemployment, trauma, and I didn't know this, but they also